We're live.
She said she's gonna turn on her video.
Nope,
She said
she's
she-
in now. I see her.
There
Hello,
she is.
Jennifer.
Hi guys, how are you?
We're good.
Good.
All right.
So lots of pieces that I've thrown at you guys. But I think with Trina's help, I've gotten I think the most updated pieces in your guys' hands, hopefully. And do you want that too? So Jen is actually wants that gonna jump on as well. She's gonna go in a different office though, so we're not colliding and making some squeaking noises here.
Gosh, here we are. Okay.
All right, so you guys tell me when you're ready for me to kind of just start talking.
We are
here.
ready.
You're
We've
ready?
got a lot
Okay.
we got a lot of paperwork in front of us. If you just tell us where to follow you on,
Yep.
hold it up and
So let's go. Let's start, you guys, with this renewal summary here. It's got the spreadsheet that we typically go through with kind of all of the boxes on it. Let's start with that piece.
okay. So ours is in black and white. Renewal summary. Okay. Got it. Says current plan, reimbursed plan, and current plan at the top.
You got it. Yep. And just so I can just confirm we all have the same one, towards the middle, there's kind of a purple bar. And you'll
Yep.
see
Gray bar.
1,000, 2,000 annual HSA contribution. Does yours say that?
No,
No, it
mine
says
doesn't.
900 and 1,800.
Wait a minute.
Hold on 1 second.
Mine does. Mine says 900 and 1,800.
Mine says 75, 150, and 150.
Some of them are zeros, some of them are
Well, the top of one says 900 and 1,800.
Yeah,
Same
so
as mine.
if you guys can maybe toss those and
Yeah, that's wrong.
the right one.
Hold on.
Okay.
This is wrong. Okay.
Wrong.
So all these are wrong.
I pulled,
All right.
remember last year we kind of went back and forth on that
I'm gonna
HSA.
make you a copy of this one.
Thank you.
Why don't you guys let me see your
Can I
garbage
make
one?
like 7 of them?
Uh-huh.
Okay.
See that one?
When we went back and forth on those HSA contributions, I was pulling the old ones. So this one is correct, and I just wanted to make sure you had it.
All right, we're getting copies made right now.
Perfect. All right.
What other documents are you going to go over with us so we make sure we have those?
So the other one that I want to make sure, which Trina and I just got off the phone, so I think you have that, is going to be this one. And this is kind of that summary, Craig, that you and I created last year with some of the costs that you wanted to know. So I went in and I simply just updated it. So to make sure everyone's got the correct one there, at the very bottom right-hand corner, you're going to see a number that says 696,755.
Yep, HRA
Wait a minute,
15% cost share.
Where is she?
Yep.
I don't have anything.
So
6,900.
look at this one. Look at this one and this one.
This one is bad.
Just set them off over here.
Yep, if you want to just toss the bad ones, but I just want to make sure we all have the right one. So if your number, bottom right corner says 696,755, you've got the right one there too.
Yep.
Okay,
Got it.
I have that.
All right.
Thank you.
Okay,
right.
so let's go through the renewal spreadsheet first. Where at the top it says current reimbursed, the current plan. It says renewal summary at the very top. So this is the standard renewal layout that I typically hand out, but there are a few additional numbers on here that I'm starting to show. It just kind of helps make a little more sense with that HRA. So you'll see in the very first column, your current plan, that's the plan that we're purchasing. So we're buying that $5,000 deductible plan. And then to the right of it, you're going to see the reimbursed plan. And it says 1,000, 2,000 underneath it. So those two columns, that is your HRA or your health reimbursement plan. That's that particular option. So going under the current plan, you're going to see current monthly cost and renewal monthly cost. And then you're going to see that those rates are going up 5.19%. So that is the carrier. That is the priority health increase, showing premium for this plan is going on a single, as an example, from $398 to $418. Overall, it's going up 5.19% on this particular plan. To the right of that in gray, we have to also take in effect the HRA utilization, because the employees, they're not getting a 5,000 deductible, they're getting a 1,000 deductible, right? So when we base their cost shares, we can't base it off of that $5,000 premium. We have to come up with what's called an illustrative premium. So we need to add in some of that utilization to come up with what's called an illustrative rate. And so when you look at this, we're always taking a snapshot of the last 12 months. So if in the last 12 months, the plan has performed very well, we're probably going to see a reduction. Or if we've had a spike in claims, we're going to see a significant increase here. And if you look, so last year when we built in the utilization to come up with an illustrative rate for a single, it was $56.19. Okay. This year we've had some pretty significant claims come in, and this, Trina, this speaks a little bit to what you and I were just talking about. So you can see we have increased your HRA utilization from $56 to $81 because of that spike of claims that have come through. So that is actually going up 45% when we build this number in. And if you go down further below, you're going to see a current illustrative cost and a renewal illustrative cost. And then you'll see that 10.14% number. So what that is that is adding those numbers together to come up with single $418.94 for the carrier, $81.60 for the HRA. When you combine those, you're going to get that $500.54. And overall, when we average this out, the HRA is actually experiencing about a 10% increase. And that's simply mostly because of the members that are in this particular plan have just had some significant costs.
So 418 plus 8160.
418 plus 8160 gets the 554. You got it.
Where's the 550? You don't have 554 on here though.
Right here.
554. It's right below it, Craig. You'll see the renewal illustrative.
Got it. I see it now. I was looking across to the right. I got it.
Nope. So we'll get there next. That's the HSA, but I want to stick to the HRA first.
Okay. Yep. Thank you.
And then if you go further down, so still that same column, you're now going to see the calculations for the employee cost share. So first we look at PA 152. And so you can see if we opted in, historically we've opted out, but if we opted into PA 152 and we adopted the hard cap, with this increase, we would fall below the hard cap. So that's good news. And what that tells me is your guys' rates, even though, you know, we're seeing a 10% increase, your rates overall are actually not that bad. Most plans today are falling above that hard cap. But it's $1,000 deductible, and that's the biggest thing that's helping you out there, is the employees are picking up $1,000. If we went to 80/20, you can see what that cost share would be. So instead of falling below the hard cap, it'd be 20%. And when we do 20%, it's going to be of that illustrative cost, that $500.54. So that would be $100.11 the employees would pay per month for a single. Or even further down, right below that, you're going to see 15% cost share. So for 2020, that's what we established was a 15% cost share. So if we followed that same percentage, the employees would pay $75.08 for a single. And that does include the increase actually I take that back, I'm sorry. The 80/20 or the hard cap includes the increase in the hard cap, but not the 15%. Kind of an idea of what the employees paid or are paying today for 2020 for this HRA plan. I do have it on that other sheet, but I'm going to rattle these numbers. $68.17 a month. So for the HRA, a single employee right now is paying $68.17 a month. And it's going to go to a two-person today is paying $163.60, and it's going to go to $180. And a family is paying $204, and it's going to go to $225. So that's just straight math. If we just say we're going to renew as is and take these increases and we keep that 15%, that's how the numbers kind of all flush out. So any questions so far?
I don't see any.
Okay. So now if we go further over to the right, you're going to see the HSA. So this one's a little more simple. It's more straight math. So you're going to see the current and the renewal. This one is not experiencing quite as big of an increase simply because we don't have that utilization built into it. The increase from the carrier is going up 6.23%. So a single premium is going from $368 to $391. And then what we'll do, or what we do, is we add in the annual HSA contribution. We add that into it so you guys can get a true picture of what your cost is as an employer. And that's where that illustrative cost comes in. So once we put in that $1,000 annual HSA contribution, that single rate renewal is $474.91, and that's the number that we would establish the cost share off of, which you'll notice below. So today that one is free, so there's no cost share to that one, but you can see what it would look like if we follow PA 152, and you can also see what it would look like if we were to adopt a 15% cost share. Make sense so far?
Yep.
Okay, so now let's flip over to this other piece. This is a piece, I don't know if everyone's seen this last year, but Craig was asking for a lot of different numbers. I think you were trying to get a good feel for the cost for the county and looking at all sorts of scenarios. And so I used the same kind of frame from last year and just plug these in simply because obviously it was important last year. I figured it'd be good numbers to use this year. So at the very top, this is going to be your HRA bucket or boxes, and in the middle is going to be your HSA. So the top, you'll see kind of the same thing. 2020 current, you've got your carrier premium, you have your HRA rate, and your employee cost share. So that's where the 2020 rates are on this sheet that I rattled off. And then to the right of that, you'll see the 2021. So you'll see where the premium is going up, the HRA is going up, and what that new cost share is. And then to the right of that, you're going to see the county costs. So we've got today, we have 2 singles enrolled in the HRA, 4 doubles, and 5 families, totaling 11 people enrolled in that HRA. So when I take the full county costs, what that would look like with those enrollees, and then I calculate out what the employee would be paying for their 15% as well. I'm able to get some total annual costs for the county and annual costs for the employee based upon those number of participants. And then when you go further down for the HSA, same thing, same layout. So you'll see the current premium, you'll see the renewal premium. If they're assuming we do no cost share again, it's straight county costs. So we've got 15 enrolled singles, 11 doubles, and 16 families, totaling 42. So this is where we've got the bulk of the membership enrolled. And then if you go down to the bottom box, and I think this was the big thing we were really trying to look at last year was, you know, what is the more attractive plan? I shouldn't say attractive, but what is the lesser or the least costly plan to the county when we lay these two out? And last year they both were real close to where it really didn't make sense to push someone one way or the other, because the overall costs were so close together. And we're seeing something very similar this year. So you'll see the breakdown of costs today based upon how the enrollees are. So the Alcona County costs renewal would be $624,000. Employee 15% would be almost $24,000. And then you'll see that annual cost. And if I were to plug all 53 employees into the HSA, and let's say we just did HSA, we eliminated the HRA, total county cost would be $634,000, and that's with having no employee contribution. Or if we said, let's not do the HSA, let's plug everyone into the HRA, and they have that 15% cost share, total county cost would be $696,000. So there is a little bit of a bigger spread than last year. The HSA is showing a little more favorable. However, I say that because that's how it looks on numbers, but keep in mind, with an HRA, it's based off of utilization. So if the employee doesn't use it, then those costs fluctuate down. Where with an HSA, it's fixed cost. The cost is the cost. Whether they use it or not, you're putting those dollars in there. Where with the HRA, you know, that utilization we're building in for that HRA rate may be half what it is, because maybe we just had a really bad year and now next year we're going to see that go back down, which typically that's what happens when we see a large spike like this.
Jennifer, I just had a question at the bottom of that breakdown of the total cost right there for the HSA. Is that total amount including the 1,000, 2,000, the HSA payment the county pays?
I think it is, but I'll have her confirm. If you look
Yes.
up, yeah.
It is, okay.
I think it's frozen.
Now, my other question on the HRA side of that right there also, is that including what, for budget purposes, the HRA total costs that the county could or would have to put out? Are any of those figures calculated in there?
Yes. So as far as what you're paying out of the HRA,
Correct.
yes. Yep. So if you look, Steph, if you look towards the top, underneath the 2021 renewal, you see that box? You'll
Yeah.
see HRA rate, $81.60. Do you see that?
Yes. Yes.
So those numbers are built in there to cover those HRA expenses. And you can see 2020, it was $56.19 for a single. We're taking that up because we've seen an increase, a spike in claims. So we're increasing that number because of that spike.
So that HRA rate is what was figured in that bottom line of the breakdown of total costs?
Yes, which
Okay.
this one here, this is for the renewal. So this isn't 2020, this is 2021 if we made no changes.
Okay, that clarifies
sense?
that.
And I can get
Yeah.
you 2020, if that's helpful. But this one is all 2021 figures. Do you want me to get you the 2020 numbers, Steph?
Could you please?
Yep. Because I've got
Okay.
it. That's really the spreadsheet I worked off of to build this one, so I have those numbers. So, I do have this, just so you guys know, I do have this being quoted out. I'm looking at Blue Care Network again. Not that I want to change carriers. I feel like this was a big change when we moved over. However, you know, if there's a significant change in percentages, and I think you guys have seen it in the past where sometimes they'll buy that business and ping it back and forth. You know, even if it's for a year and it can save everyone money, then it makes sense. But I have not gotten those quotes back. The carriers are running extremely slow. I did request a self-funded quote. I requested another prescription carve-out quote because I want to see, you know, if we've got any prescriptions today that may allow us to create some savings there. Again, I see savings for a lot of our counties. I can do that. And you guys just, for whatever reason, we haven't been able to see the savings for it to make sense. Now that we've got everyone on that HSA, it still might not make sense because typically it works better in a non-HSA situation, but we're still going to look at it. And then the last thing I'm looking at is what's called a level funded plan. Very similar to being self-funded. In fact, it is a self-funded plan, but it acts like a fully insured plan. So instead of having the incredible risk of a self-funded where, you know, I like to call a spec a deductible. So right now, you guys are responsible on that HRA. Your
Exposure.
thank you, Craig. We're not even sitting together and you can fill my blanks in. Between that 1,000 and the 5,000, that's only $4,000 for a single, for a single contract. It sounds like a lot of money, but when you look at a self-funded plan, instead of a 5,000 deductible, you buy maybe a 50 or a 75,000, sometimes 100,000. The county then pays all the claims up to that dollar amount. So a lot of times a group your size, that's pretty risky to go into a situation like that because, you know, we could have a situation where we've got someone in the hospital for a month and it could just blow those costs completely out of the water. And so when we're looking at it, we just got to make sure that we're looking at it conservatively because I certainly would hate to come to you with something like that. And so with a level funded, what I like for a group your size is it gives you a fixed cost. So we can still have maybe a savings from a self-funded $50,000 stop loss, but we position it with what's called a gap product on it. So that way your exposure is fixed to X amount. And assuming there's savings upon that exposure, then it makes sense. So that's the other quote I'm waiting for to get back. It's becoming pretty popular. We were doing it a lot in the real small segments, 25 and under. And so we're starting to see some more attractive rates in that 50 to 99 group size. And I'm curious to see what it looks like for you guys. So those are some things I'm looking at. I did get a couple of declined quotes already as well. And I'm hoping to have all of those back within the next week, maybe 2 weeks at most. And then we can kind of go back through them. But based upon what you guys see here today, I guess, what is your thoughts? Is there anything different that you guys want to see?
Jennifer, before they go into answering your question, I have a question about the HRA. Can we back up a little bit? The deductible or the out-of-pocket max from last year was $7,915.8. what I'm showing on your quote is that that's gonna increase in 2021, is that correct? To the 8150,
So-
623?
So what happened is, yes, we had, I gotta go back to last year's, but if you recall, last year, they had a change, your plan was mapped. And so that actually, so you'll see here, actually it's noted on here. In gosh, I thought this happened in 2020 where it went, or maybe it was mapped last year too. You guys remember that out-of-pocket max went up. So you'll see here, right now it's 7,900 and see where it says 8,150 in 2021. It's carried over
Yeah.
into the gray. So that tells me that it must have been mapped again because it was mapped last year too. So what they're doing there, Trina, is to meet the metal levels. So you've got your gold, your bronze, your silver. These plans have to equal out a actuarial value to hit that metal level. So each year when they look at the actuarial tables based upon the plan design and the dollars that were paid out as a whole, so not just Alcona County, but as a whole book for Priority Health, they have to sometimes make adjustments to the plan. Sometimes it's in the prescription, sometimes it's in the flat dollar copays. We see Blues do it actually a lot with the flat dollar copays, but they're adjusting upwards your out-of-pocket max a little bit.
Okay, but that doesn't actually affect the actual deductible that they have to meet or anything, it's just the
No.
out-of-pocket max.
No,
Which isn't
and
really expected to be
yeah.
met anyway.
it's a pretty minor change in the grand scheme of things. Most of your employees are not, if any, are hitting that 7,900. We may have had one or two just because we've had some pretty big claims come through this year. But what happens? So just so everyone understands it, and I'll follow the reimbursed column if you want to follow along with me. But you've got 1,000, so the employees that are on this plan, they have $1,000 deductible. After that deductible, they have a 10% co-insurance up to $1,500, okay? So those first three line items, that's going to be like your hospitalization, your lab work, your x-rays. So if somebody goes in and has major surgery or they're in the hospital for a month, they're going to pay $2,500. That $1,000 deductible and that $1,500 co-insurance max. So $2,500 is what they pay. They go in a week later and have another huge bill or an X-ray or CT scan. They don't pay anything because they've now hit that deductible and they've hit their co-insurance max. The dollars they paid though, that $2,500 does go towards that $8,150. So once you subtract that out, the remainder of that is hit with either office visits or prescription copays. And if somebody were to hit that, their entire plan now kicks in 100%. Meaning if you go to the pharmacy and you're used to paying $80 for a drug and all of a sudden it's free, that should tell you you've hit your out-of-pocket max. Most people don't hit it. The nice thing with the HRA is the dollars that Alcona County pays. So we talked about that exposure. So they're paying $1,000 and Alcona County is paying the other $4,000 because we're buying a $5,000 deductible, right? So those dollars that Alcona County pays out of that HRA also goes towards that $8,150. So the employee's out-of-pocket max is actually much lower than that number when you factor in the dollars that Alcona County pays.
Now, I was under the understanding that with the HRA deductible, the only thing that was contributing to that would be x-rays, blood work, and hospital stays. Is that still correct?
So in general, I always say hospitalization, x-rays, your lab work, hospitalization, lab work, x-rays, you've got your outpatient visits. There's a benefits at a glance though. You really have to look at that. because there could be some other things, but in general, it's your bigger expenses that go towards that. Sometimes with your CT scans, there could potentially be a flat dollar copay. So we'd have to look at your benefits at a glance to see, but it's typically, that's what it is. Your office visits, your chiro copays, your prescriptions, those do not go towards your deductible. Those only go towards your out-of-pocket maximum.
And then one more question, Jennifer. We didn't have the 10% co-insurance on the HRA and the employee portion last year, but it's being quoted in this plan this year.
Okay.
I have a message out to our underwriter to confirm that that is correct on that,
Okay.
because I just
Thank
had
you.
noticed it myself.
I'm gonna pull last year's piece too, so we'll get that corrected.
And then Jennifer, I just have one last thing too. Basically, last year the HRA hadn't changed much compared to the HSA. So it was cost effective for the county to keep it at that point. And then this year we got hit with those large claims. And we can see a huge increase in the HRA area. So I guess I'm just stating it out loud as a matter of fact, maybe for the board's consideration, but okay.
Yep. So that did go up. Now, with that being said, staff, keep in mind, if, we had all of those and I shouldn't say all, there's 11, but if we had those members over in the HSA, we probably would be seeing a bigger increase on the HSA. So just kind of keep that in mind, that those costs are going to go somewhere.
So on the breakdown of total costs, where you propose if everybody was on the HSA, that 634 could be more, based on what you just said?
Not for this year, but for next year.
Not
If
for
there was
this year,
utilization.
but if I were to take a look back last year and let's say we didn't offer the HRA and we had those 11 members
Oh, okay.
combined on the HSA plan this year, instead of seeing a 6.23% increase, we probably would be seeing a higher number. But that increase is not taken in effect those members because they rate them separately.
And again, how many members do we have on the health savings account? Was that 53 or 58?
42.
We've got 42. So 42 are enrolled in the HSA and we have 11 enrolled in the HRA.
And is it Jennifer Weinstein on the right? And then Jennifer on the right, on our right, we have a question we're probably gonna email you about later on in regard to a part-time at the sheriff's department.
Okay.
Is pushing his hours to be offered health insurance. And
Okay.
we kind of are looking for some direction there.
Okay. Yeah, just send me an email. Is this stemming from the last email on the hours and tracking?
Yes. This is kind of a new area for us, so,
That's okay.
okay.
With that being said, I will just mention that, we may, if I recall, your guys' payroll system tracks the hours, correct?
Yes, we also have the payroll clerk down here as well in the meeting.
Okay. So in that system, so you're tracking hours. Are you tracking hours for Affordable Care Act in that system, and it tracks for the measurement period, the stability period? Like I had talked about in that email, is that doing that for you?
No, it's not.
No,
Okay, so remind me, who do you guys use for payroll?
BSNA?
So they have a module that will do that for you. I only say that because it's something you really don't want to do manual. It's a lot of work. And it should track everything to tell you and pop up to say, this particular person is eligible for benefits. Come you're effective for your your next stability period. So in your accounting period, you need to get them added. So it's kind of an automated thing. We have a system that does it as well. So we use our own B-Swift program, and that's where we can do even online enrollment for you guys. So the employees have everything online, and it takes a lot out of your guys' office with collecting apps, and everything's done electronically, including, you know, HSA contributions. We've talked about this in the past, and then it can also do the tracking and reporting as well. But if your payroll system does it, then maybe that's the better route to go. But I think one or the other would be certainly a good idea. I don't know. I can reach out to, who's your rep at BSNA?
I don't know.
That's okay. I'll reach out to them. They're actually a customer of ours, so I'll reach out to them and find out what that would cost you guys. And if it is significant, then maybe we turn ours on and we can feed it over, because
It's a whole
I don't want to
system.
have two things for you to go into.
Right. I think you're talking about the HR portion of the BSNA, and we do not have that. It wasn't cost effective.
Okay.
So we have like one person every few years that this runs into. So and it was in regard to, you said B-Swift? Yeah. So I don't know that would be something that we'd be able to afford to utilize, so.
Okay. Well, just give me a call on that and we'll talk that through.
Okay.
And see what makes the most sense for that particular individual. The biggest thing is we don't want someone to become eligible. We lose sight of it. They go to the marketplace, apply for coverage, and the IRS it triggers a audit to you guys because they want a subsidy, and they technically could have been eligible for benefits because it can trip it up by the questions they're asked. And we don't want that audit to come back on you guys and find an error, because then there's a penalty on every single one of your employees, not just that one. So we just want to make sure we don't run into that issue. And a lot of times it's the sheriff's department where we have to be careful, because, you know, their hours there could be a part-time employee where they trend eligible because of their hours during that measurement period, and we don't realize it because of their overtime.
Correct. Okay.
So, but we can talk about that later. It can be extremely confusing. So I just want to make sure we've got all of our safety nets in place so we don't run into an issue. So
Okay.
lastly, I did include again too, this piece. It's the agenda with a few notes. So this is kind of my initial summary when I went through everything. Don't know that unless you guys went through it and had some questions, but some of this is more of a duplicate of what we talked about, summarizing some of these costs. So I lay these things out in several different ways. We all learn differently. So whatever's easiest for you to navigate through this. But the costs for the most part are kind of on all three of these pieces. In here, though, it does talk, I pointed out a few things that are contributing towards your increase. I always like to look at why are we seeing an increase? I want to make sure it's justified. We're not just, giving an increase to give an increase. And, right now with COVID, we've had a lull in claims too at one point. So I want to make sure that the claims are up, which we did have a high cost claim. We had one that was not quite high, but it was what they call mid cost. And you'll see that towards the bottom in the large, this little graph here. So we've got one employee that did exceed that $75,000 large claim threshold. And then the one below it. So those two are really a hurtful. Those don't help us, let's put it that way, but that's what insurance is for, right? Is for those bigger claims. Trend, so if we were to look at just simply what is trend, if we didn't look at your utilization whatsoever, it's about 4.99%. So you guys are really on average with trend, even with those big claims. So, at a glance, if I were to look at this, I would have thought your your increase would have been maybe even bigger than this, but we'll take it. It doesn't look like, so those two particular claimants that are on here, when we look at the predictive modeling, it doesn't look like they are going to continue to be a high cost claim. So that's good news. And what that means is we're looking for someone that maybe has cancer or MS or something chronic that's ongoing. We want to look to see, is this something that we're going to be faced with next year as well? Or is it more an auto accident or something like that that's not necessarily ongoing? And so the predictive modeling, when it looks at these claims, what it's basically saying is, you know, these are not ones we expect to go ongoing. Can't predict the future. You know, we may still have somebody else that has this issue, but we can at least kind of get an idea based on utilization. There was a 3% change in enrollment. So that was some coming on or some coming off, which then shifts your age and gender factors a little bit, because all of that does play a role into the renewal development as well. So we did have some shifts there. We had a specialty drug filled, and I think this one's been on for quite a while. It's one that I've been watching. So I don't think this is anything new. We had this, I believe, the same drug with when we were on with BCN. But this drug it's $3,600 per month. It's pretty expensive. And so in the 12-month period for pharmacy for that one specialty drug, it was almost $81,000. So pretty big drug that's on there. And then we had another big one at almost $12,000, and that drug's off the plan. So that's going to help us with next year's renewal as well. And it was taken into effect when they're looking at establishing your rates too. And I always encourage, so if there is anybody that is on a specialty drug that you guys are aware of, please have them reach out to me or the team. Just because if there is opportunity for me to find a alternative source for them to get that drug and get it off the county plan, I would love to do that. And in most cases, when we do it, it's the employee doesn't have a copay at all. So maybe it's looking at some manufacturer coupons or something like that. So right now it is processing through on your plan. So even if they are using something to wipe out that copay, it's still hitting. So if you happen to know who that is or in conversation, always suggest for them to reach out.
I'm always amazed, Jennifer. I'm on allergy pills. I have 3 that I take. And in a 6-month period, I can go in and get it refilled, depending on what it is, 3 or 4 times. And I can spend anywhere from $30 to $80 on my copay for the exact pill. Well, I say exact, it's the same name of,
right.
You know, the drug is the same.
So you're saying from month to month or 90 days to 90 days, the change cost or the cost of the drug changes? Yes.
Makes no sense to me at all.
So that is the pharmaceutical world, and that is something that is part of the problem. You could go in one day and get a prescription, and the next day get the same exact prescription from the same company, manufacturer, and it could be a 50% spike. At one point, they said it actually would go up through in a 24-hour period, meaning if you picked a drug up in the morning, in the evening, it could be more expensive when the typical run through the drive-through to get your prescriptions after work is up. I don't know if that's true. That's something that was said at one time, but drug costs definitely change from day to day. I always recommend using that tool. Med Tipsters, I've thrown that out before. There's Good RX. But if you go out there, especially for you guys, if you're on the HSA plan, if you go out to one of those apps and plug in the name of your prescription and your zip code, it's going to show you the cheapest pharmacy around. Now, I know in Harrisville, we don't have a ton of options, but for those especially that maybe are living a little bit further out, they may have more options, but I always encourage that. Something that I will look at, and I'll follow back up the next time we connect. We do have a new partnership with Clever RX. It's CLEVER, Clever RX. They have an app. And what I'll do is we'll follow up, Trina and staff will follow up with you guys with a brochure and the codes that you plug in to use that app. And if you guys want to kind of play around with that, you can. It doesn't cost you anything, but hopefully it will save the employees some money. And if some of you guys play around with it and you're seeing some savings, then it might make sense for all employees to download that app. I just don't know in your area because of the limited pharmacies, but we'll try it. Because again, with the HSA, you know, if you can get the same drug for even $5 less, that's $5 more that's rolling over in your HSA plan.
All right, anybody have any other questions? I don't hear any, Jennifer.
So really quick, it looks like since the agenda was put together, it looks like we did get the Delta Dental renewal. So Delta is renewing with no increase. So we're good to go there, no changes. We're good to go on the VSP, and Lincoln Financial also came in with no change in rates for 2 years as well. So the big thing that right now then we're focusing on is the medical. All the other lines, those are going to renew as is. Have you guys, is there been any discussion as far as PA 152 goes to where you guys are ready to kind of say this is the route we're going to go? Because with this next analysis that I throw out, I'll take off some of those calculations to make it easier to read, or do you want to continue to see them all?
Well, I anticipate we're going to opt out again, or if we do PA 152, it'd be with our own hard cap.
Okay. Is there anything you want me to customize? So, you know, I could show the 15% like we're doing. Do you want me to look at, I think the actual hard cap went up, I don't know, it was like around 2.8% or something. Do you want me to maybe take that 15% and add the increase of what the hard cap went up? So take it up to maybe like 17%?
Well, I'm looking around here. Anybody?
Totally up to you. And I'm not saying you have to. I'm just trying to be proactive so that way when I come at you guys, the numbers are all there.
Yep.
So would 17% on the
Instead of 15. So the hard cap increase at the state, right? The state increased their hard cap by a certain percentage.
Yep, I think it was 2.8%.
Okay, so it increased that 2.8 onto the 15% and make it a 7.
So it's almost 18%.
Yeah. I think we're still stuck on the 15%, trying to maintain that, though that's just me, but I don't hear anybody saying anything.
I think where we are.
Yeah, let's just keep it at that. We can always do the math if something changes.
Okay, sounds good. Well, I will give you guys an update then, as soon as I get some of those additional quotes in, and if any of them look attractive or where we can create some savings, certainly get it over so we can talk that through more. If I don't get anything, then we will set another time to sit back down and discuss this again on how you want to roll this out.
Jennifer, if we could go back to the page, the 44 North page with where you identify some of the factors.
Yep.
And on the one you say one fill of a drug at 11,000. Drug is off the plan now. Is there another drug that has the same value that is on the plan, or did they just? I mean, if the doctor prescribes ABC, it's possible that DEF has the same qualities and can do the same for the patient, or does that patient just not have any option other than to go on it alone?
So that could be, so I don't get the full details of this drug or who this member is.
Right.
So it could also be this member just simply is no longer on the drug. Maybe they're no longer on your plan.
Oh, okay.
So
okay.
it's just a matter of this particular drug isn't showing up on your utilization anymore, which is a
So-
good thing.
When you say drug off the plan now, it's just that it's no longer being used. It is still
Exactly.
available. Okay.
Exactly. Yep. Yep.
Okay. Thank you.
You're welcome.
All right.
Any other questions?
Is it ever going to go down?
Nope, I don't think so. I think we're covered.
Okay. All
All
right.
right,
Well, you guys
Jennifer?
holler if more questions do come up, but I will
All right.
continue to keep you updated. And then we'll just kind of go from there.
Alrighty. Thanks,
All
Jennifer.
right.
Thank you.
You're welcome. Have a good day. And then Trina and Steph, you guys just feel free to holler whenever. My day tomorrow, I'm on the road almost all day, but I'm pretty open on Friday.
Okay.
All right.
Alrighty. Thanks, Jennifer. Have a
Yep.
great day.
You too. Bye.
All right. You want to open this one now?
Sure. Do you need a motion to do it, or are you good?
I think so. We received it, so.
Yeah.
She just sent that this
Divided
morning.
it. I don't
I
You
didn't
just have
even-
to
I
get
didn't-
it,
I
just
haven't even
as-
looked at it.
Just like
It's
the
not
civic
even
system.
related to things, so.
I think she was just.
Just checking.
Two? Are the same, I wonder?
Oh, man.
Really?
I don't have a problem with it.
Yeah, you haven't seen the email yet, but you haven't seen the email yet, but you will.
Not on board with what Jennifer was is when she.
I have a feeling I don't
said
want to see
that
it.
if
You don't.
see somebody that's on a medication.
Kim did this. It's a little bit of a more clear view on
Oh,
numbers.
If we could get another
Clarity's
medication
good.
cheaper,
Yeah, this is just the
let me know so that I
HRA
can
and
look
then the
into
top
it.
is the
I
HSA,
think
but
it's
this,
right.
this shows
I-
25, 50, and 100% utilization for the deductible.
We'll have to make copies, I suppose, would be the,
Recommend to them to get.
Kim
Should I
came
go
up with
see it?
that.
okay.
Get them.
Okay,
It'll be interesting to you.
But yeah.
Are we off the
yeah,
record
the
yet?
impression
Are we?
that
No, we're still on.
We're still in the
we were
meeting.
aware of
Because
it,
we're looking
but
at
we-
So I've opened the Mesa.
I mean, it was like.
Yes, John.
But what
got the
I
answer.
what
That's
it
done or
would
no?
be is.
No,
um,
we haven't adjourned.
Whoever comes to the meetings, which half of them don't.
Yes.
Oh, it's the
is
Mesa.
say
Yeah.
that
thing.
if you
So
are
where are they
on a
coming out at?
medication,
Well, trying to read, so we don't have a, okay.
Now that makes more sense.
Sure,
She did
sure,
not say it
yeah.
like that at all, and I thought, whoa.
16.
You know, you can't.
Census used, okay. So it looks like quoted benefits, 1,000, 2,000, 1725, same over. So it looks like they're singles. Anybody got a piece of paper in front of them? What we
I think
got?
she knows 'cause
Our singles on here
and she'll go.
are
Not
566.51,
saying any names, but
I don't-
556, 61.
51,
but they get in.
1274.64 for two,
Yeah.
and
I mean, there's a couple, like,
1586.23.
idea, but I'm not even 100% sure. besides
family.
HRA.
What was it on here? So
Which I just
considerably,
did.
more. HSA was 1,300 for a family,
Check. So,
and 1,501
Is it-
for
oh,
a
already journaling.
HRA.
Because my bank reconciliation.
There's. could
And
be
then
some
there's
sort of-
another ancillary plans. So their dental will cost 119 for a family,
I did.
That's in the ballpark of ours.
119 for a family, 95 for two person, 39 for a single. And
That's pretty close to ours.
their vision is 7, 15, and 23.
It's also close to ours.
So we got to look
They're
at
probably quoting Delta.
coverages. Medical plan highlights single coverage of 1,400 deductible. Two person and family is a $2,800 deductible, 10% coinsurance. ABC prescription, single out of or annual out of pockets is $3,400 for singles, $6,800 for two person and families. So those are all And the HSSA, or the HSA, I think this is, I believe, in network health, 1,000, 2,000 deductible, $20 co-pays, $20 visits, no co-insurance, 3-tiered drugs. I can make copies for everybody if you
Yeah,
look through all this. I have two, I think these are both the same. Believe, yeah. This one looks better. So I'll give these to, if I give these to you guys, will you make copies and spread them around? This is the Mesa one. I don't know how you decide the difference between Plan 1 and Plan 2. No, Mesa Choices, that must be the HSA. Our HSA is a $1,000 and a $2,000 deductible, right?
Yes.
So that must be either comparing, that's a 1 and
No,
a
sorry, it's a 2 and a 4.
2 and a 4. Well, this says 1 and 2. ABC Plan 1.
He said he would present whenever, especially if we could do it via Zoom like we just did.
Okay, well, let's get him,
Yeah, we should have
we
it.
need him here then to do that.
Okay,
Because I mean, I'm not gonna sell his plan.
right,
Let him
I'm
sell his
trying to
plan.
make heads or tails of it.
I'll leave this with you, and anybody wants it, they can take a look at it. If you want a copy, make copies, or, and all this other stuff. Okay,
Yeah, this is what Trina talked to him yesterday, and this is a 3-week register time, absolutely.
all right, so I don't think we're gonna make a decision on this today.
Okay.
Anything else? We have, where'd Carolyn go?
A couple weeks ago.
I think she adjourned without us, no, probably the bathroom.
Anybody else have anything to add?
Nope.
All right. Well, it was enough, it was a quorum to adjourn this meeting, so
Let's
all
adjourn.
those in favor say aye.
Yes.
Motion carried, the meeting is adjourned.
Are we
I'd
gonna
like
do
to-
the finance thing real quick?
What's that?
Didn't you want to have some questions? Trina was working on inputting into BSNA yesterday, maybe she can just answer your questions.
No, I don't need that at a meeting. That can be part of the budget,
Are we doing a budget?
whatever, the finance meeting.
Today.
Finance, okay.
Yeah, if we can squeeze one in right now, if you can't, let me know.
Sure, if that's what we wanna do.
Yeah, it don't have to be long.
Okay.
Okay.
I need to-
Is that in, do we have that in email or not? That Mason